So, the restoration of endodontically treated tooth is today's topic. The importance of the coronal restoration is that the post-endodontic coronal restoration is important to prevent the ingress of the microorganisms into the coronal pulp. It also helps in preventing the coronal leakage, so it should provide an adequate coronal seal and long-term follow-up to evaluate the integrity of the restoration. So we'll see the factors which makes endodontically treated teeth different from the vital teeth. First one is the structural changes or the architectural changes. What happens here is the fracture resistance of the tooth decreases as more the tooth structure is lost due to the decay dental procedures and or due to the endodontic procedures. So here the tooth becomes more brittle and there would be more risk of the tooth fracture. And what happens is that there would be decrease in 14% of the strength and toughness of the dentin due to these changes. Next, we'll see about the aesthetic considerations. Non-vital tooth show the loss of translucency and the discoloration due to various reasons like the necrotic pulp, endodontic procedures, and the root canal filling materials. So, the loss of tooth structure due to the fracture or caries requires a further aesthetic considerations for restoration of endodontically treated teeth. And next we'll see about the biomechanical changes. Here, the proprioceptor feedback mechanism is lost after the endodontic treatment. This might subject the endodontically treated teeth to a greater loads than the vital tooth. Now we'll see the restorative treatment planning for endodontically treated teeth. Here, according to the Ingress and Perroz, we have classified the restoration plan of the endodontically treated teeth depending upon the amount of tooth structure and the number of walls remaining around the access cavity preparation. Here the class 1 shows the 4 remaining walls around the access cavity, and the class 2 and 3 shows the 2 or 3 remaining walls around the access cavity. In these cases, the crown is indicated, and the class 4, the 1 remaining wall around the access cavity, in such cases the post is indicated, and the class 5 here, the no remaining walls around the access cavity, where the placement of the post is mandatory. If we observe the occlusal forces and the anatomic position of the tooth, the anterior teeth with a minimal loss of the translucency can be restored with a coronal tooth structure, or if it is discolored, bleaching and veneer should be considered. And the posterior teeth with a considerable structure requires the restoration with an onlay or the tooth to protect it against the fracture. So in case of the extensive damage, we have an option of post and core followed by the crown wherever it is indicated. So now we'll see the restorative requirements. So the teeth included has an abutment in the fixed or the partial dentures undergo the more forces, and thus they need additional retention and protection against the fracture and caries due to the leakage. Whereas the aesthetic requirements are considered if there is a loss of translucency and the discoloration in endodontically treated teeth, especially in the aesthetic zone, requires the restorative material like tooth color post, composites, or the ceramic cores or the ceramic crowns. So these all are the restorative treatment planning for the endodontically treated teeth. If you see the components of the restored teeth, that includes the residual tooth structure or the remaining tooth structure, and the post and core and the crown. If you observe the residual tooth structure or the remaining tooth structure, in such cases here the dentin tissue and the unbound and the bound water are taken into the considerations. Whereas for the post, the shape of the post and addition of the post to the dentin and the diameter of the post and the elastic modulus of the post are taken into the consideration. Whereas for the core, the material has to be checked. Whereas for the crown, the loading angle and the ferrule are checked for the further processing. So, if you go for the post and core, what is a post? It's nothing but it's relatively rigid restorative material placed in the root of the non-vital tooth for the retention of the core and also helps to transmit the forces onto the core and then to the root. So, the purpose of post is to retain the core and to distribute the stresses through the radicular dentin to the root apex. And if you see what is core, it is nothing but the structure which holds the post material. Okay, this is this is nothing but it's a supragingival portion that replaces the missing coronal tooth structure and forms the center for the new restorative material. If you see the classification of the post, it is nothing but they may be the custom made or the prefabricated. The custom made are preferred in cases of the mobile teeth or any other considerations, where the prefabricated are of two types, that is the metallic and the non-metallic. The metallic include the stainless steel, nickel, chromium and the titanium, whereas the non-metallic includes the zirconia, ceramic and the fiber post. Now we'll see the factors which affect the endodontically treated teeth and its placement. So we have to plan the endodontically treated teeth, and for that we need the few restorative and the resistance and retention form features. In that, the post length is that the first feature, that is the post length is one of the most important factors affecting the longevity of the post. As the length increases, the retention also increases. So we have few guidelines regarding the post length, that is the post should be at least long as 2/3 of the length of the canal, or the length of the post should be at least the coronal length of the core, and it should be half of the length of the root in the bone. If you see the post diameter, it has little difference in the retention of the post. As the post diameter increases, the resistance form also increases, but also increases the risk of the root fracture. So we have three different theories regarding the post diameter in the literature. One is the conservationist, that is, it is suggests that the narrowest diameter that allows the fabrication of the post to the desired length with a minimal instrumentation. And the preservationist is it advocates that greater than 1 mm of the sound dentin should be maintained circumferentially to resist the fracture. And the proportionist is that it advocates the post width should not exceed 1/3 of the root width at its narrowest diameter, and it also resists the fracture. If you see the post design, the parallel sided post may distribute the more stresses and more evenly stress distributed when compared to the tapered post, which may also have the wedging effect. And the parallel post will generate the highest stress at the apex, and the high stress can generate during the insertion. So the threaded post produces the high stress during the insertion and the loading. If you see the luting agent, the post is retained in the prepared canal and the post channel with the dental cement. On the factors that influence the durability of the bond of the post to the root are the compressive strength, tensile strength, and the adhesive qualities of the cement and the cement potential for the deformation, micro leakage, and the water imbibition. So the most commonly used luting cements are the zinc phosphate, polycarboxylate, GIC, resin modified, and resin based cements. If you see the canal shape, the most form of the shapes of the canal are preferred by knowing the root anatomy of the different teeth is also important before starting the canal preparation for the post installations. The most common shape of the canal is ovoid, and the prefabricated posts usually come parallel in shape, so these are unlikely to adapt along the entire interface with the canal walls. So we should have an appropriate knowledge to place the post. Coming to the position of the tooth in the dental arch, the location of the tooth in the dental arch also affects the post retention. If you see, for example, the maxillary anterior teeth have the higher risk of fracture because of its compressive tensile and the shearing forces, especially at the post-dental interface. Whereas the posterior teeth tends to be more retentive when compared to the anterior teeth. Coming to the preservation of the tooth structure, that is, one should also try to preserve the maximum of the coronal and the radicular tooth structure whenever possible, because minimal removal or of radicular dentin for post-paste preparation should be the criteria. So, the strengthening effect degrades with the time because of the weakening of the resin-dentin bond as the tooth is exposed to the functional stresses. If you see, the most important part is that the ferrule. Ferrule is nothing but it's an 360 degrees metal collar of the crown surrounding the parallel walls of the dentin, extending coronal to the shoulder of the preparation. And if you see, this is just like a crown bracing against the remaining supragingival tooth tissue. And it has been suggested that it should be 1 to 2 mm of the vertical tooth structure, which helps in doubling the resistance to the fracture. If you see the requirements of the ferrule, the axial height of the ferrule, it should be greater than or equal to 1 to 2 mm. And the margin should be always placed on the sound tooth structure with the ferrule having the parallel axial walls. And the restoration should be completely encircling the tooth with a thickness of 1 mm to be effective. And also it should be 4 to 5 mm of the suprabony tooth structure. And the restoration should not encroach on the biological width. If you see the functions of the ferrule, it is found that 1.5 to 2 mm of the ferrule reduces the fracture resistance of the endodontically treated teeth, and the protective effect of the ferrule is due to that it dissipates the forces that concentrate at the cervical area of the clinical crown. And it also protects the integrity of the root by the embracing action, and also reduces the lateral forces exerted during the post insertion. See, if there is no ferrule, there would be the fracture by the wedging effect or by the tapered post. So the ferrule is necessary, that is 1 to 2 mm, to counteract all these forces. If you see what is a core ferrule, it is nothing but the contra bevel given on the prepared tooth for the cast post with the collar of the metal which encircles the tooth. It is independent of the ferrule given by the cast crowns. If you see what are the modes of failures for the post and core is that it may be the failure in the form of the post fracture or the root fracture, the core fracture or the post dislodgement or the aesthetic failures. So the retrievability of this failed post is by the use of the rotary instruments and by the solvents, or by the use of the ultrasonic, or by the special kits like measurement kits, or the post removal systems, or the endodontic extractors. This all helps in retrieving the post using these materials. So we'll see the next part of the post and core, that is the core. It is nothing but the supragingival portion that replaces the missing coronal tooth structure and forms the center of the new restoration. If you see, it is also known as a miniature crown. There are various materials available for the core buildup, that is the dental amalgam, glass ionomer, composites, and the custom-made post. And in a recent techniques, we have gone through the other recent method of restoring the grossly decayed tool, that is the endo crown. So this is one of the recent technique where the crown would be fixed to a internal walls of the pulp chamber. See, in the picture also you can see the crown having its walls affixed to the tooth structure and even to the pulp chamber and the cavity margins that provides the micromechanical bonding by retention also, which helps in the use of the adhesive cements. So you can see clearly observe the picture, the crown with the pulp chamber crown extending into the pulp chamber. It also gives the micro retention to the tooth structure. So this is all about the restoration of the endodontically treated teeth.